But about now, though, we get right on to a segment called Broken Body Series. On the line, I do have Dr. Baggett. Morning, Doc.
Good.
You heard
Good
that.
morning. How are you?
I'm well. Thank you. I hope you're good too.
Yeah, I saw a bit of hesitation in your voice.
Yeah.
Anyway, we're still at the beginning of the year. Anyway, we're going through the tummy and the gastric or digestive system, and we talked about issues to do with the mouth and then the swallowing and then the tummy over the last couple of weeks. And we're moving on from the stomach into what's called the small bowel, which in medical terms is called the ileum and the jejunum. Nice words to say, and they basically mean the small intestines and the mysteries around small bowel disease. And let's shed some light on some of these misunderstood conditions. I want to get two of the most important ones out there. They're not very common, but some of our listeners might have them. We seem to have a growing listenership, which I'm really chuffed about. Those two diseases are called Crohn's disease and celiac disease. Now, Crohn's disease is basically an inflammation occurring anywhere in the gut, leading to and often it's picked up late, Zandile. People have pain and they have diarrhea and they have fatigue, and they just put it down to something they've eaten or, a bad bout of flu or gastric flu, etc. But actually, the pain continues and the diarrhea continues and you have mucus in your stool and you're just constantly tired. It may be that you have inflammation in your gut, and this condition is called inflammatory bowel disease or Crohn's disease after the person who discovered it, called Crohn, who was an 18th century physician. Celiac disease, on the other hand, is something that is a little bit more common, and it's something that occurs in those who are gluten intolerant. Gluten is that famous thing we like to talk about that you shouldn't be eating anyway, whether you have celiac disease or not, and that is bread and rice and pasta and palachi and fresh chips and all that stuff, because it can cause lots of issues. But in those who really can't tolerate it because it really is toxic to their system, it causes extreme bloating and abdominal discomfort, and they don't absorb anything and they get nutrient malabsorption. Now, sounds unpleasant, and then how do we know if we have these? Well, clearly the issue is symptoms. And I don't want people out there to think, I really get bloated sometime and I must have inflammation of the bowel. We'll talk about common causes of bloating. Do you get bloating, by the way, Zandile?
Of course, dog. I get it.
Yes, exactly. People get bloated. People have flatulence and they want to fart all the time. And this issue may be something that's got nothing to do with inflammation of the bowel. It's something what you ate. And we'll talk about that in a minute, because that really is the basis of my talk today, because that's the most common one. But in terms of inflammation of the bowel, how do you know you have it or you don't? There are tests like blood tests. You can see inflammation in your bloodstream. There are stool analysis where we take a sample of your poop and we have a look at it under the microscope, and we can actually see inflammation. We can see mucus. And in some situations, we do what's called endoscopy, which is a camera test where a camera is put down from your mouth down into the small intestines, into the duodenum and jejunum. And we look in to see how inflamed it is, whether it's cancer growing, whether there's inflammation, whether there's a bug going on, because early diagnosis is really crucial for proper treatment, for which there is lots of medicine, and people can actually live a completely normal life. Speaking of treatment, what can we do to feel better? Well, for Crohn's, there's medication. And of course, the specialist who you usually need to see, called a gastroenterologist, will give you some dietary adjustments to manage the inflammation in your bowel. Celiac disease, on the other hand, requires a really strict gluten-free diet for life, but both obviously rely on personalized plans for optimal outcomes. So you'll see a specialist that probably refer you to a nutritionist or a dietitian, and you need to take medication. And with that, you can actually live a very normal life. So that's really important. Somebody's asked here, okay, Naka, you're talking about all these diseases, but what about prevention? Yeah, you're right. Prevention is always better than cure. And so how can we help our small bowels being happy, if you like? It's a good question. And it's always coming back to the same things, whether we're talking about diabetes or heart disease or stroke or even today bowel disease. It's about a balanced diet that's rich in vegetables, a little bit of whole fruits, not fruit juices, whole grains are the cornerstone for your gut. Staying hydrated, managing your stress. We know stress can cause inflammation of the gut, and believe it or not, getting enough sleep can all go a long way to this. Somebody's asked here, are some of us more prone to these diseases due to our family history? Yes, genetics can play a role. We're getting some pretty wise listeners, Zandila. Genetics, genetics can play a role, but it's not the whole story. Environmental factors always are important, like smoking, like certain medications, and even gut infections can trigger or worsen these conditions. So, the things in the environment that we can control to lower the risk are things like limiting processed foods. This, again, go back to borotwa and palachi and rice and pasta. These are processed foods. All the nutrients have basically been taken out, and you're eating basically sugar. So avoid these ultra-processed foods. I know it's difficult because we're surrounded by them. Avoid excessive antibiotics because you kill your natural gut bacteria by taking continual courses of antibiotics. And practice good hygiene. Create a gut-friendly environment. Natural things like what we call probiotics, which are fermented foods like yogurt, madila. These are good for your gut. These are and prebiotics, which are sort of things, the fertilizer, if you like, that the natural bacteria in your gut eat. Things like garlic and onions will really support a healthy gut ecosystem. But remember to consult your doctor before starting any of these supplements. So there's a lot to learn in terms of that. But I want to talk about the main one that affects a lot of people out there, which you also seem to have been complaining about, and that is bloating. And it's a condition that often occurs because of something that one ate. But if you're constantly bloated after eating a meal, you may have a condition called IBS, which stands for Irritable Bowel Syndrome. And when doctors talk about syndrome, it basically means we hardly know what the cause is, and we still don't know in 2024 what the cause of IBS is. But a lot of people have it, and they don't know they have it. And it's something that causes bloating after almost every meal. They really feel uncomfortable. They have to loosen their belt or their dress or their undies because they can't. They have a lot of flatulence. They have a lot of burping, and sometimes it presents with acute pain. Do you have any of them?
Not really.
Yeah.
As you've been talking, I've been trying to wonder if at all I have those. No, doc, not today.
Yeah. So most people have bloating, and usually what we do or always do, because everybody has bloating, because not everybody can tolerate all foods, and then there are certain foods that encourage bloating, and people know it. I mean, some people can't eat quinoa. You can't eat beans because it really ferments people. In some people, the outer coating called lectin tends to ferment in the stomach and the bowel and causes intense bloating and really uncomfortable heartburn. A classic one is palachi. If you eat a lot of mealy meal, if you eat a lot of bread, if you eat a lot of pasta, you may bloat, you may have gas, and you may feel really uncomfortable. And people often just, go to the chemist to get a remedy rather than preventing the stuff. So do a food diary. Look to say, Kante, if I eat this thing, I know I'm going to get bloated. And then remove it from your diet because otherwise your body's definitely going to punish you. As I said, we don't know what causes this IBS, which is generally a condition that we need to give some medicine for, but it can be treated naturally. One is remove the foods that are causing this intolerance, and it's difficult, so stick to foods, for example, like meat and certain veggies. Avoid certain veggies like beans and even peas sometimes. Some fruits can cause people to bloat. So avoid those things because they can cause problems. Somebody's asked, like, I have lots of bloating, but I think it's due to lactose or milk. Can you explain what lactose intolerance is? Yes, lactose intolerance involves difficulty digesting milk sugars. And as a result, what happens is you don't have the enzyme called lactulose. And so what happens is the milk begins to ferment. And it can lead to bloating, discomfort, and some people actually use it to clear their bowels. So they'll take a glass of milk and they know that the bowel will move because the bowel just ferments and that produces extreme running stomach. But that's not a great way to control constipation. Like I say, for constipation is lots of water and lots of fiber, so that's really important. Somebody's asked here, are small bowel surgeries common for these diseases? No, not always. Medications and dietary changes are often the first line of defense. Surgery might be considered in situations, but that's really important. So it's really important, like I always say, to talk about the environment. And the best foods for bloating and even for IBS are things like lean meat, avocado, eggs, sweet potatoes, spinach, all these things are really important. Omega-3 fatty acid containing foods like fish, so that's really good. Somebody's asked you, I don't have IBS, but it sounds very uncomfortable. How uncomfortable is it? Well, patients with IBS can describe abdominal discomfort in different ways. It's sharp, it's the sharp pain, it's cramping, it's bloating, it's distension, it's a fullness and even burning. And they know it's triggered by certain foods, sometimes even by stress. Do you get bloating if you're stressed, Andile?
Yes. King, early last year, I got that. I was even shocked. Can this actually happen? But yeah.
Absolutely. And we're actually now beginning to warm to the old saying that you have a gut instinct. And that comes from the fact that we now know actually the gut has millions and millions of nerve fibers that go into the gut, almost like a second brain. And people who have bad small bowel issues know that if they wake up with an issue in their bowel in the morning, the rest of the day is really ruined. And they equally know that if they're stressed mentally, the bowel will be affected, particularly with IBS patients. Their bowels get worse, they twist, they turn, they bloat. So managing stress is really important. Somebody's asked you, I do have IBS and it makes me feel constantly tired. Is tiredness a symptom of IBS? Yes, fatigue is a common symptom of IBS, and probably as many as half of all the people that I treat with IBS struggle with their energy levels because you're not absorbing properly. You need to change your diet and your lifestyle. You need to balance the natural bacteria in your gut. You need to manage your stress. It's a lot of stuff, but if you don't do it, it's really important. Somebody's asked you, can you live a long life with IBS? No, you can. As long as you control what you're eating, it's definitely something you can live with. I'm going to stop there if you have any questions.
Doc, I remember the last time I even went to the doctor when this happened. I was just eating veggies and meat. Oh, Doc. I had some serious bloating after some few days of only eating strictly veggies and meat. Why was that the case?
That may well be because you may be eating more meat than veggies, and it may because remember, meat is protein, and protein is a very heavy food, and everybody needs protein, and you do need to eat, whether you're a vegetarian or not. You need to make sure you have a good protein intake. Really is an important issue, particularly as you get older. Protein is important because old people lose their protein and become really skinny and frail. So that's important, but you need to balance that protein with a good portion of veggies, and those vegetables need to be your greens and your fiber. So once again, we're talking about, Crohn and Botswana and lebelebele and all those sort of grains that need to be put into your diet. If you're eating very few of that high fiber vegetables, you'll definitely constipate because the protein in the meat needs traction. It needs something to push it through the gastrointestinal system. So it may well be that you're not taking enough fibrous veggies. Mm-hmm. Were you eating balanced veggie portion?
I thought so. So that's
what sort of veggies were you eating?
Broccoli, literally everything. I won't lie. I can't.
And that's very good. I mean, people. You remember, for those listening out there, you need protein to survive, and you need fat to survive, but you do not need starch. You can live without starch because you can get your starch or your sugars from the veggies that you eat, from the fruit that you eat, and your protein from the meat or the lentils that you eat if you're vegetarian. But you definitely can get away with eating no sugar or starch. And remember, we're talking about the same old things, bread and rice and pasta. These are processed starches, which you can do without. And actually, you will lose weight consistently if you cut some of those processed foods out of your diet. People out there always talk about, I'm going to the gym and I'm not losing weight. The reason is they're working hard and burning a few calories at the gym, but they're going home and eating some of this rubbish. So keep those things out of your diet. If you're going to go on a veggie and meat diet only, make sure you're taking lots of water. That's really important. And make sure that your vegetable portion is bigger than your meat portion on your plate. And you got a mixture of veggies, so broccoli, cabbage, spinach, morojo, dinawa, those sort of mixes, you really can't go wrong. And if you're still having constipation, go and see a doctor because something else may be going on. But when you went back to your starch, as a matter of interest, what did your health practitioner advise you to do?
You know what? I think maybe that time I was just going through something because I was having, besides the bloating, I was also having some, I thought it was allergic reactions. So the doctor was in a bit of, okay, you have allergic reactions. Maybe the bloating may be because of what you are eating, and then the allergic reactions maybe because of the stress that you are going through. Because I I was even shocked that you can get allergic reactions from stress.
Absolutely. Stress is one of the most common conditions that we really take it lightly. We brush it aside. We take a sleeping pill. We take a stress pill. Don't do that. If you're stressed, clearly, there are some things that you need to manage rather than cure in terms of stress. There are financial stresses, there are marital stresses, there are emotional stresses, there are relationship stresses, there are work stresses, there are all sorts of things that can stress you. And one is to recognize what the stress is, and two is to try to deal with it as much as you can. Where is it written, life is easy? Everybody has an issue, but if you don't manage it, indeed, like you've said, your body will punish you, whether it's in the form of bloating or stomach cramping or acid or lack of sleep. And of course, when you have all these things, you tend to want quick fixes like comfort foods. You'll eat badly. You'll sleep badly. You may, if you're a smoker, take more cigarettes. If you take alcohol, you may take more alcohol. If you're a chocoholic, you'll eat more chocolate. So stress can have just your thoughts can actually have a multiple cascade of symptoms that lead eventually to diseases. So the cornerstone is to go upstream and say, what is causing all this stuff, rather than, can I have a stress pill? Can I have a sleeping pill? Can I have, a laxative because I'm constipated? Ask, why is this happening to me, rather than what is the treatment for it?
And then, Doc, you're asking when I got back to starch, what happened? I actually thought eating starch made everything better because, I don't know, the bloating stopped. So
it depends what starch you ate, but remember, starch is sugar, and sugar is a feel-good thing. Whether it's the sugar in a donut or the sugar in a slice of bread on a toast, or whether it's sugar in Palachi, it makes you feel better, but you pay. So if you're going to eat starch out there, make sure the starch is high-fiber starch, it's unprocessed starch. I cannot emphasize this enough, and people talk about bread, whether it's brown or green or orange or yellow, bread is bread. So this marketing idea that you're eating whole wheat bread or brown bread, it's really just a hoax. It's marketing out there. So don't fool yourself in terms of boroto. Boroto is boroto. It's just like saying, Naka, I'm eating brown sugar. Whether it's brown or white, it's sugar. So don't let the marketing industry fool you into taking something that really is not very good for you. So
even the brown rice.
Good. So next week we're gonna
wait, Doc, wait. Even the brown rice. Even the brown rice is just marketing. I'm such a spoiler for people who want to eat out there. Look, you can eat these things, but I want you to be aware that they're not the best things for you to eat. We're not monks that live in the mountains, so you can eat those things, but I want you to be aware. I don't want people to say, Naka, I didn't know. So knowledge is power. You can do those things, but once you've cheated, you say to yourself, I've cheated. I need to behave for the next few days. I don't want ignorance to be bliss. True.
We'll talk next week, we're talking next week about the final part of the digestive system called the large bowel. Lots of things to talk about. So tune in next week, 10:30 for the Broken Body series.
Thank you, Doc. Till next week. Right, it's 10:48 on up at your station of choice. That was Dr. Baggett giving us that section on Broken Body series. For now, though, it's music coming from Aliyah and The Weeknd.